Recovery after prostate cancer treatment depends on the treatment of choice. Radiation therapy has different side effects than surgery. Seeing a men's health specialist after prostate cancer treatment can allow you to explore all the options to treat any and all side effects of the prostate cancer treatment. After prostate cancer treatment, a man may experience new onset erectile dysfunction, including difficulty obtaining and maintaining erections. Prostate cancer treatment may adversely affect bladder function and cause symptoms such as stress urinary incontinence or urinary urgency and frequency, as well as overactive bladder symptoms in general. The recovery process after prostate cancer treatment depends on the modality. There will be a period of time when patients may experience urinary urgency and frequency, as well as stress urinary incontinence. There will be also a period of time when patients may have difficulty having or maintaining erections. These can be sorted out by the physician, and treatment options may be recommended at that time. You should always discuss your recovery process with your physician. There will be a period of time when you may require medications as well as other treatments for both your urinary function as well as erectile dysfunction. Long term, other more advanced treatments may be offered depending on your recovery. Long-term cures for erectile dysfunction after prostate cancer treatment may include medications, injections, vacuum erection devices, or a penile prosthesis. Typically, the one that lasts longest and is the most reliable tends to be a penile prosthesis. Urinary difficulties after prostate cancer treatment are very common. These may improve over the course of several weeks to several months after treatment. However, if there is continued persistent urinary incontinence, then options such as a sling or a pump may be required. In order to minimize issues with penile length and girth, it is important to follow your physician's recommendations. You may be prescribed certain medications to assist in blood flow, as well as be instructed on using certain devices such as a vacuum erection device. In order to stay healthy, it is important to have a well-balanced diet and to engage in physical activity and routine exercise. It is also important to visit with your family physician and follow all of their recommendations and guidance.